So it's my pleasure to introduce Dr. Karla Unger, a health systems research fellow at the Mexican National Cancer Institute with a strong interest in the development of successful implementation of context-appropriate evidence-based interventions for cancer control and prevention in Mexico. Dr. Unger's research is focused on understanding the lived experience of cancer patients to access timely diagnosis and treatment. She was a commissioner of the Lancet's Women's Power and Cancer Report, published in 2023, that proposes a more holistic approach to cancer research, prevention, and care by applying feminist values and principles of social justice. I'm going to go ahead and introduce Martina as well, and because they're both together presenting on the LISTOS project. Dr. Martin Lajou is a medical doctor and cancer epidemiologist. He's a faculty researcher at the National Institute of Public Health in Mexico and an adjunct professor at the Harvard T.H. Chan School of Public Health. He's the PI of the Mexican Teachers Cohort, and his research interests are cancer epidemiology, implementation of cancer control and prevention programs.
Thank you. Thank you so much for the opportunity to share a little bit of our work, Maria, and thank you for all of you who are still holding up and here sharing yet another talk. So I'm going to briefly talk about LISTOS, who Margarita just briefly also talked about. So first, reflecting on all of those who are here who do not speak Spanish, as what LISTOS means, which was actually a very lista idea, a very bright idea from Maria when we were writing this grant. And LISTOS stands for Leveraging Implementation Science to Optimize Strategies for Cancer Control. But the word listos in Spanish has two meanings. On one side, it means being ready. And this is very relevant across our projects because we're using the readiness framework. And we're trying to improve readiness in our setting in order to implement. And then listos also means smart, different to just being intelligent as knowledgeable. It means being intelligent in how to be practical, how to really be able to do something without the extra effort that you really need. So our center, aligned with this word, listos, our central goals are to improve readiness for implementation. And for that, we're going to be focusing on research capacity building and also on making evidence-based interventions that have proved to work for improving cancer control, making them ready to implement them in our context-specific setting. Okay, and we want to do it in a smart way. So a pragmatic, co-created way that is embraced by both the community and the organizations, and that are long-term sustainable. Okay, now it's not going forward. Do I do it here? Okay. So these are our main activities. First is to establish the LISTOS Center. First, we're going to focus in Mexico, but we want to be open to include other countries, other researchers who want to participate in our trainings and bring on their own line of work. We're also going to be developing, strengthening these EBIs that we have selected for the projects. And then, of course, improve research capacity through training and mentoring. We're strongly going to be basing our work on mentoring through our research projects. So this was already mentioned. We're being funded by the NIH for this center. It's a multiple PI collaboration between the three of us. And through these two cores that Margarita already explained as the main components of all of the U54 hubs, which is to foster collaborations and build capacity, mainly through mentoring, but also training, and then working through research projects. We're going to now talk to you about the three Well, I'm going to briefly mention the three of them, and then I'm going to present briefly about the breast one and Martin about the colorectal one. This one, the colorectal cancer screening, is also in collaboration with UCSF. And finally, we just submitted an administrative supplement and hope that we can fund our first pilot project, who is led by Leticia Torres, who we are also mentoring as part of LISTOS. She's a junior researcher. I saw her here a little while ago, but not now. Okay, and so now I'm going to talk briefly about the breast cancer project, which I lead. So the idea behind this project is that it's proven that as cancer stage advances, survival is reduced, and this unfavorably impacts mortality. And so what is behind this late presentation that is very common, not only to Mexico, but many low and middle income country settings, is that it takes too long from symptom appearance to treatment start. In Mexico, between 85 and 90% of patients detect a problem through breast symptoms discovery. And then they have to go and contact a first health center wherever they can. In the public setting, it would be ideal that they come to the health center that's publicly available for them without cost, and that they could get referred straight on to a diagnostic clinic. But what happens in reality is this cloud, this red cloud that you see there, where they have to use multiple different settings to get diagnosed. They need imaging, they need biopsy, usually at least 2 or more different imaging tests. And this can become months of waiting before they arrive at the cancer center. So what we want to do with this project is work in the primary care clinics of an uninsured population healthcare setting. And through these implementation strategies, which we are going to, of course, tailor and adapt, and maybe identify that we even need to do more implementation strategies, strengthen the referral for timely diagnosis to a diagnostic clinic that is already working in our context. These are our 3 aims. First, we will assess barriers and facilitators and readiness. Then we will use implementation mapping to design these implementation strategies. And finally, do a hybrid 2 implementation effectiveness trial to evaluate implementation and effectiveness. And well, LISTOS is a huge team and expanding. So thank you to everybody who's collaborating with us.